Hello, my name is Dylan Miguel Dalip, Master of Public Health candidate at St. George's University, and my health policy for the initiative is improving the MMR vaccination rates across the United States. So vaccines have drastically changed the world of public health. A lot of vaccine preventable diseases have been eradicated. The one disease that I would like to focus on is the measles, mumps, and rubella group of diseases. And these have recently proven to be of great importance in public health, especially in the United States. So vaccine preventable diseases have been treated with vaccines for many years, and especially since the measles outbreak in 1960s and 1970s, it became of great importance. Now, in the last few years, there's been a resurgence of these vaccine preventable diseases due to many reasons. A couple of them that are most important are vaccination hesitancy due to misinformation and lenient non-medical exemption policies. And this will be the most high yield parts of my presentation today. Now, it's important to know that these non-medical exemption policies varies by state, and vaccination hesitancy can be due to a conglomerate uh, set of information or misinformation. So there's been an increasing trend nationwide in non-medical exemption rates. As you can think that this will cause reduced vaccination rates. Now, this is very important uh, for public health as a whole, because when a population is vaccinated, the more amount of people that are vaccinated confers onto that population herd immunity, especially for those very few who are unvaccinated. The vaccine may not be effective anymore, or the few that are immunocompromised. So the higher the rate that are not vaccinated creates a cluster of people who are unvaccinated and breaks this protective effect of the majority being vaccinated and protected. This is called herd immunity. And the breakage of herd immunity causes outbreaks of the disease. Now, to alleviate or prevent these things from happening, modern laws require children older than 5 years of age to be vaccinated before entering the public school system. CDC had declared the endemic measles, mumps, and rubella eradicated from the US by 2004, but since then, the rates of non-medical exemption has been increasing. As we can see in this slide, MMR vaccination rates were in the 90s for most states. As I said before, they vary according to states. But those that have the asterisk, like California, Mississippi, West Virginia, they had very strong non-medical examination, rigid policies that basically mandated most people get the vaccination. Hence, the non-medical exemption rate in these places were very low. Mandatory vaccinations are enforced as part of the powers of the state police, but it's important to also note that while each state varies in their exemption policies, there are no federal requirements when it comes to mandating vaccinations, and this is wholly and solely left up to the states that the health policies serve. So the evaluative criteria, legally, as I stated before, there are no federal laws mandating vaccinations, and there are some great differences in the leniency of exemption policies for non-medical reasons varying by state. Now, a political evaluative criteria is that many states might have more lenient policies because public perception might be of greater value there. If they are more stringent, the public might have more opposition to the vaccine or more opposition to the political powers that be. Ethically, the unvaccinated, as I stated before, if we have an increase in these numbers, will increase the risk of breaking herd immunity. And this would put more people at risk due to an outbreak. It directly opposes the ethical principle of do no harm. Economically, increasing this unvaccinated population and breaking herd immunity would also lead to outbreaks. If you have an outbreak, then the public health sector would be under significant financial and human resource burden to be able to prevent spread of the disease, contain the disease, and really treat what is happening with these vaccine preventable diseases. So the status quo for measles, mumps, and rubella that we have right now, vaccinations are mandatory for all entering the public school system, but some states are very lenient with their non-medical exemption policies, leading to a higher rate of unvaccinated. Now, when we come to the alternatives, we can have the state regulations reduce the leniency of non-medical exemptions from vaccination, especially in those states that have more lenient exemptions. Also, a possibility is that we can institute federal regulations to mandate vaccinations across all 50 states and make non-medical exemption requirement more uniform. The third part, or third alternative, will include counseling. Now, as I said before, vaccine hesitancy is a major problem. And especially with the measles, mumps, and rubella vaccine, in 1998, Andrew Wakefield proposed a study that was poorly conducted and did not meet proper research guidelines, but it was published in the Lancet, and it showed a falsely causative effect between the MMR vaccination and autism. Since then, the vaccine, this theory has been disproven. The article has been retracted, but there still is a great doubt in the minds of parents about this link and creating vaccine hesitancy. So mandating counseling and the importance of vaccines can dispel some of these misconceptions from the minds of parents, because research shows 70 to 80% of parents have doubts about giving their children vaccines. It doesn't depend on what the doubts are, but they have doubts. If we analyze these options, there are good and bad things that can be stated for each. For state regulations, this is something that can be powerful because every state is different. And if we address this problem at the state level, we can apply more comprehensive, intimate control of the problems. However, input from other states might be very crucial in preventing the problem that can be a national epidemic. Federal regulations can create uniformity and benefit the most amount of people. However, the uniformity might leave those states with much more lenient policy, and those states that need more support, we might leave them wanting. Counseling can improve informed consent and dispel all of these misconceived notions. However, parents can feel that the primary care physicians are forcing their beliefs onto them and infringing upon their religious rights or rights to autonomy. So my final recommendation is that I strongly believe that my alternative to bolster the enforce state regulations involving non-medical exemptions to the MMR vaccine would be most beneficial. At a state level, I truly believe that each state can address this problem depending on their needs in a much more comprehensive manner than mandated by a federal policy. This process, which non-medical exemptions is attained, should be a thorough process and vetted. The policy changes to allow this must be structured to suit the needs of the state when the reasons for exemptions are investigated. And also, you can have a policy, but proper enforcement and follow-up would be very crucial into making it a successful policy and increasing adherence. There can be some limitations to this. With multiple different state legislatures governing health policy, we can have a lot of variability. And with variability, we can have further negative results on MMR uptake. With more stringent laws as well, the population might feel like their rights are being infringed upon. Their religious and personal rights are being infringed upon. So this can also be met with opposition and lower current vaccination rates. In conclusion, The declining rate of the MMR vaccine uptake in many states is leading to a resurgence of the disease. And this can have a disastrous outcome. This break in herd immunity can lead to outbreaks, and for public health, this can cause very, very negative sequelae. Therefore, getting states to have more thorough vetting process for non-medical exemptions through better health policies and increased enforcement is a crucial step in increasing the MMR vaccination rates across the United States.